Welcome to our video series on how to be a good doctor. Today we will be discussing the interpretation of arterial blood gases, and this is only the basics. I am Dr. Iresha Gunasinghe, a consultant physician from California. So my goal is to teach you how to interpret a stat, arterial blood gas, or as we call it, ABG. There are two organs involved in the management of acid-base balance in our body, which is the lungs and the kidneys. The first thing you have to memorize are the normal values, okay? We have four. pH, which is 7.35 to 45, PCO2, which is 35 to 45 millimeters of mercury, PO2 or oxygen 75 to 100, and bicarb 24 to 32. This sometimes some labs put it as CO2, making it more confusing. Now each lab, there may be slight variations, so it is important for you to memorize your own lab's normal numbers. Now there are some words you have to understand. The first one is acute, which basically means happens over a short period of time. And the second word would be chronic, which means it has been happening for a longer period of time. And if it is something chronic, the body would have had more time to compensate. The second set of words is acidosis and alkalosis. So this depends on the pH. If the pH is low, then or less than 7.35, then we call it a acidosis. If the pH is more than 7.45, we call it a alkalosis. Okay, so acidosis, alkalosis. The next is respiratory and metabolic. So respiratory means the primary problem is with the PCO2. In metabolic, the primary problem is with the bicarb. Okay, so these are the next two words you have to remember. Now, when we put it all together, we can come up with 8 combinations, right? So you can have an acute respiratory acidosis or a chronic respiratory acidosis. You could have an acute metabolic acidosis or a chronic metabolic acidosis. And the same thing is true for the group with alkalosis. The next word you have to understand is the word compensated. Remember, the body is constantly trying to get things back to normal, which is in this case the pH. It's trying to get it back to normal. Now, this you have to really understand, okay? So, if it is a respiratory acidosis, the pH is less than 7.35. And because it's respiratory, we know the primary problem is with the PCO2, right? So the organ that's going to help is the kidneys, and it'll adjust the bicarb. Okay? And so if it is alkalosis, then obviously the pH is 7.45, right? More than that. So because it's a metabolic, the primary problem is with the bicarb. And who will come to the rescue? The lungs. And it'll do that by adjusting the CO2. So remember, when one organ is not doing well, the other organ comes to help. Okay? And if they are successful, then we call it compensated. So this is an important principle in medicine. Always be methodical. Don't jump from place to place. Very, very important principle. So the first thing you are going to check when you get an ABG is the pH. You decide, is it low? Then it's a acidosis. If it is high, then it's a alkalosis. So that's number one. Next, you see which is the main culprit. Okay, so if it is a um, um, acidosis and it is of the respiratory kind, then the PCO2 will be high, right? And the compensation, PCO2 will be high. And if it is an acidosis of the metabolic kind, the bicarb will be low, right? So in the alkalosis, it will be the opposite. And then finally, you see whether there's a compensation, just like we talked before. If it is the kidneys, they mess around with the bicarb. If it is the lung, it'll be messing around with the PCO2. Again, the 8 different scenarios. I'm just going to touch on a few common ones so you get a sense as to how this happens, okay? So if it is an acute respiratory acidosis, so acidosis implies the pH will be less than 7.35. Now, because it's a respiratory, we know the PCO2 is going to be high. Now, it's a respiratory problem, so therefore, this is another thing you might see where the oxygen will also be low. Now, because it's a lung that is diseased, who's going to come to the rescue? The bicarb. Since it's an acidosis, we want the opposite, which is we want to alkalinize the blood. So how does that happen? By increasing the bicarb. So this is a very common thing you'll see in most acute lung disease. Now, there are a lot of chronic lung diseases you will come across. And in those, what will happen is the pH might have become normal because it is compensated. Okay. Now, the next is the opposite. So, respiratory alkalosis. So, the word alkalosis implies the pH is more than 7.45. So, what should happen to the CO2? It will be low. What will be the way for us to get the blood more acidic using bicarb? We have to reduce the bicarb. And a common example would be hyperventilation. Okay. Acute metabolic acidosis. So, acidosis implies pH is less than 7.35, and now this is a metabolic. So, that means the primary problem would be with the bicarb. And how will the blood get acidic? By the bicarb is low. So, what would be the compensation the lungs can do is to reduce the PCO2. Now, this too is a common thing you will see, which is diabetic ketoacidosis. Okay. And the last set would be acute metabolic alkalosis. The word alkalosis implies the pH is more than 7.45. And since it's a metabolic, the bicarb is going to be high. And the compensation, because it's an alkalosis, we need to make the blood more acidic. How can we do that? By increasing the PCO2. So if you understand the basic, interpretation is not that hard. Now, there's a lot more you have to learn, but this will be the basics that you have to learn. So you have to learn important points in the history. You have to learn what to look for in the physical exam. You have to know a concept called the anion gap and how we use the urinary chloride in making the diagnosis. And of course, the treatment of specific conditions. So these are all the things you will have to learn later. So remember the golden rule, always be methodical and keep practicing. And what are the three things that you have to do? Number one, you check the pH, decide whether it's an acidosis or alkalosis. Number two, you decide where the primary problem is. And then number three, you decide whether the body is trying to compensate or not. So that is all for today. The best way you could help me and thank me is by being a good doctor and helping people in need without expecting anything in return. And I sincerely hope this will help you. And also, please do take a moment to share this with your friends. Good luck.